Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator Dr. Stasha Gominak, answering some of our frequently asked questions, as well as others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. So, are seizures related to sleep?
Hi, my name is Stasha Gominak. I'm a retired neurologist and now I'm a sleep coach. And Heather and I are answering short questions that are related to what we call the Right Sleep program. This question today is a really important question, and that is, are seizures related to sleep? And I first began to wonder about that when I was a neurologist and had started to do the Right Sleep program with my headache patients and realized that I should be having a similar conversation with my epilepsy patients. The word seizure usually refers to a general loss of consciousness that can sometimes be accompanied by falling to the ground and other things, but sometimes there's a brief loss of consciousness where the person is staring straight ahead. And those alterations in our consciousness are somewhat similar to an electrical glitch in the computer where the computer just stops working. And those can be related to electrical events. And the electrical events in our computer are about the functioning of the computer itself or the electricity supply. In the brain, we absolutely use electricity. We use positive and negatively charged ions, things like chloride or calcium or sodium. They are positive and negative charges, and they flow in and out of the cells, and they turn the cells on and off. So we have electrical glitches, just like you'll experience at home when your electricity goes out. Now, the important part is that the control of this electrical state is supposed to be constantly in a controllable state, so you can wake up and use your brain. And when one of these episodes of seizure happens, you can't use your brain, and in fact, you can't really do anything. And usually you become unconscious and then wake up again. Everything I'm going to say about the connection between seizure and sleep refers to someone who does not have a brain tumor, who has not had a stroke, who does not have an actual injury to the brain tissue itself. So one of the major variables for having epilepsy is genetic mutations that mean that some of the cells are a little bit hyperexcitable. But the interesting part about those genetic mutations is that we now know that there are many family members in a family with genetic epilepsy who never experience a seizure. So if I had a patient who would come in and just had their second seizure, and I was then discussing whether or not to put them on a seizure medication, it would be a logical question for that person to say, well, my cousin has this same marker and has never had a seizure. Why can't you change me into my cousin? So there's a second variable, and that second variable frequently is how well does the person sleep? And that has to do with the fact that when we sleep, we restore our brain chemistry and our brain excitability. That means as I began to notice that my headache patients had abnormal sleep studies, I also began to notice that my epilepsy patients had abnormal sleep studies. We've known for many years that sleep was playing a role in epilepsy. For instance, we would often sleep deprive a patient before doing an electroencephalogram, before doing a test that would test their likelihood of seizures, because sleep deprivation would make the abnormalities on the brain recording a little more obvious. We also knew that sleep deprivation in someone who had underlying epilepsy would increase their risk of having a breakthrough seizure. So there were several clinical observations that connected the two. But my view now is any person who's had a seizure needs to have a sleep study and needs to undertake every sort of treatment available to improve their sleep if there are any abnormalities.
That's interesting about the genetic marker because I do have a family member who has had a couple grand mals, and that's the only family member that has experienced them. So fascinating. All right. Well, thank you, Stasha, and thank you everyone for joining us. Please subscribe to the channel, then like and share the videos. You can find more information as well as the Right Sleep program at drgominak.com. Remember, we see our doctor once a year because we heal our bodies every night. Until the next sleep chat, sleep well. Bye-bye.